I'm Larry Nigerian, and I'd like to welcome you all to the town hall. This town hall program began in March when we could count the number of people with illness in the United States and the world in the single digits, and there was no deaths. And here we are. We started out doing this every week. We're now at every 2 weeks. The purpose of the town hall is to bring people together, to help decision makers from the clergy, nonprofit organization world, and the leaders in our community more aware of the facts related to COVID and understand the impacts of COVID on all the different aspects of our life. We are very blessed this evening to kick off this year with a better understanding of what's happening in Armenia and how we can assist. Dr. Sarah Golian, a lawyer from Los Angeles, now in Armenia, will be speaking and informing us of how we can help, what's needed. We're very fortunate to have Oscar Tatosian join us as well. He is the honorary consul to Armenia and is very involved in stimulating business interests in Armenia. And we have a guest appearance from a new young member of our community, Ani Panosian, who will be talking about contact tracing here in America. So we're going to introduce another outstanding panelist, Dr. Celine Kojoglanian, who many of us know, but for some of you who are joining us for the first time, she's board certified in pediatric infectious disease. She's an associate professor of pediatrics and infectious disease, has contributed to the literature on COVID-19 and has been just keeping us so up to date with what's happening. She's also an executive board member of AAHPO. Thank you so much for joining us again this evening, Celine.
We're going to do a vaccine session for you guys and of course for a much bigger audience. So I'm not going to spend any time on vaccine unless any one of you has any specific question that I'll be happy to answer. But I just wanted to maybe touch upon other things you have learned, you have heard in the news is about the variants or the mutated viruses that have made it into the news this week or in the past couple of weeks, I should say. So there is good news and a little bad news. So let's start with the bad news. The bad news is that there is two variants, one in the UK and one in South Africa, which have are probably going to make their way through worldwide, that have mutated enough that has made them, at least in the minimum, more transmissible, therefore more contagious from one person to the other. So that emphasizes the fact that our mitigation measures, unfortunately, more physical distancing from each other, universal masking, unless you're literally on your own, are going to be crucial until we get, as Larry said, mass vaccination underway. So the other thing about the variants, specifically the South Africa variant, is that for those of you who are scientists and medical professionals on the call, is that the area of the mutation is such that it's actually in what we call the RBD, which is the receptor binding protein or the spike protein where the cell attaches to the virus. And if it continues in this way, it might actually make some of the monoclonal antibody treatments, the two that we have in the market right now, probably ineffective. So don't quote me, but what I'm trying to say is that, again, mitigation measures are going to be crucial. Is offered a vaccine or is told by their caretakers or their state that they have a vaccine for them, please jump on the opportunity to take it. For us to get into some normalcy.
It does give me great pleasure to introduce our next speaker. I'm meeting her for the first time. She is a friend of Dr. Kim Akimian. Dr. Ani Panosian Moradian is a degree in public health from Rutgers University. She's currently a contact tracer and case investigator in Hudson County Department of Health. This is in New Jersey, a very densely populated community of immigrants and others. She also is very involved in the Armenian circles. She's a member of the ARS, a member of the St. Barthanot's Church, and vice president of the Hamakalyan Cultural Association.
So this is the first time I'm here. My name is Ani Panosyan, and I'm a contact tracer. I'm going to talk about my experience today. So contact tracing is the process that is used to identify those who come into contact with people who have tested positive for an infectious and contagious disease. So contact tracing is not only specific to COVID-19, it's been a long-standing practice here in New Jersey and worldwide. It has been used to contain many contagious diseases like HIV, measles, Ebola, tuberculosis. And now, of course, it's being used hopefully to contain the coronavirus. So contact tracing is an important practice because it goes hand in hand with testing and finally with the vaccination. So contact tracers also offer support and guidance to people who have tested positive. So when we make the call to people, sometimes we are the only people who are reaching to them and comforting them, because many of these people don't have access to healthcare because of unemployment or because of other issues. And also, even if they have access, even if they have a healthcare provider, uh, some doctors are not willing to see COVID patients in person in their offices for understandable reasons and referring them to emergency room. So again, sometimes we are the only people who are reaching to these cases, even though we don't offer any medical advice, but of course we give them support and guidance. Recently, I talked to a person, to a case who was about 35-year-old gentleman. He was a professional and he was exposed to the virus in his job. And we had just a regular conversation, and I was about to conclude the interview. And he casually said that he doesn't want to live anymore. He wants to end his life. So of course I was very shocked. I wasn't anticipating anything like this. And I asked him that probably he doesn't mean what he's saying. And he said, no, I'm very serious. I'm really considering suicide. So of course I was very shocked, and I reached my supervisor right away, and I kept calling this guy for 3-4 days. And eventually I was able to transfer him to a suicide support hotline. So these are the things that we are facing, not just like COVID infections. So the contact tracing initiative in New Jersey is a state-sponsored initiative. It started by the Health Department of New Jersey, which collaborated with Rutgers University. So Rutgers hired most of the contact tracers, and I have to say that Rutgers was biased. So most of the contact tracers that were hired were Rutgers alumni or graduate students. So Rutgers offered us a comprehensive training, which was based on the COVID-19 courses prepared by Johns Hopkins University. I have to say that the onboarding process of contact tracers was daunting because the number was huge, and eventually Rutgers was very overwhelmed because it's an educational institution. It's not a recruiting institution. So they had to transfer the contract to another company, which is called PCG, Public Consulting Group, which is Boston-based company. And this same company is running the contact tracing efforts in the state of New Jersey, New York, and Massachusetts. I want to talk about some of the challenges that we face as a contact tracers. So when someone gets tests for COVID-19 and the test result is positive, the lab or the hospital sends us that person's name and phone number and the address to the health department, and we call them. So one of the biggest challenges, of course, is that some people don't pick up the phone for different reasons. Our protocol is that we call them twice and leave them a voicemail. Fortunately, some of them return our call after, I guess, hearing to the voicemail, and others pick up the call for the second time. But we still have a big number of people who never pick up the phone, which is a lost opportunity. And the second challenge is that sometimes we are the ones who need to deliver the bad news to the patient. In most cases, they are already aware that they tested positive because the lab contacts them, or they just check and update their portal, their health portal, and they get the news. But in some cases, we are the ones who need to give them the bad news. And I would say that there are two groups of people, the two different reactions that people show. The first group is that they really expect the positive test because either they're having symptoms, especially if they have the loss of sense of smell and taste, which is very specific to COVID. They know almost 100% that this is COVID. Or if they are showing symptoms, or if there are like many people who have tested positive in their family, in their household. So they already almost certain that the test result will come back as positive. But then there is a second group of people who are not symptomatic, who are asymptomatic. They have just been in contact with someone who tested positive, or they have traveled, or they are planning to travel, and they just take the test as a routine. So these people get really shocked when we tell them that they tested positive. Sometimes they don't even believe that the test is correct, and they question the validity of the test. So it is very important for us to build trust, to start a conversation and an interview with these people. One of the methods that I personally use is that after introducing myself, I give them some of the information that I have, just to let them know that I'm not a random person. I tell them the place and the date where they got tested. In most cases, this works and people trust and start the conversation. But in other cases, people get aggravated and they ask me, how come you have access to this information? This is my personal health information. This is protected by HIPAA. You should not be able to know this. And of course, I take a deep breath and I tell them that maybe they are not aware of this, but infectious diseases are not protected by HIPAA. In fact, labs and hospitals are obligated to inform health departments if someone tests positive, or not just for COVID, maybe for other infectious diseases as well. And I give them the example of child abuse or domestic violence, just like when a healthcare professional identifies or suspects the evidence of a child abuse or domestic violence, they are obligated to inform it, and they might get in trouble if they just ignore and not report it. So in the same manner, labs and hospitals and doctors need to report the cases to the hospitals.
Dr. Kim Akimian does want to make a few quick comments. And Sarah, thank you so much for being gracious to give us an extra few.
So very, very quickly, I just want to update everybody on what's happening in Armenia. This is a timeline of events in Armenia since the 1st of March, which many of you have seen. The blue bars here, in this is by date from March 1st until this week. And these are the number of cases, average daily number of cases. And as you can see at the start of the war, the red bars we've decided to keep color coded as the weeks of the war. You can see, we've talked about this many times, the increase in cases. But what you can see, interestingly enough, is this decrease in cases post-war. The question is why? We do see, this is, these bars represent the total bar is the total number of tests taken in that week. And the black, the yellow are test negative, the red are test positive. And so the black line is what we call, right, the positive test rate. So it would seem that the number of tests have gone down, but equally the number of the number of positive cases have also gone down. And I'm not going to talk about it tonight, but there are some theories that we have about why that is the case. And we think that there's just a lot less testing going on because of the holidays and because of a number of other issues. So a sort of a better proxy measure is 7-day average deaths, which are coming down. This may be a little bit of noise again in reporting. This was quite consistent, that this number, this 26, 28, 29 represents a day's number, the average over 7 days per day number of deaths, right? So you want, for the number of deaths in the week, you would multiply this number by 7, right? Which is quite significant for a country of Armenia's size. Again, this was Armenia's first surge in June and July. This is the surge in deaths after the war. So there's unquestionable, data that really does show us that the onset of the war led to a series of deaths, largely preventable deaths from COVID-19 as well. This last two slides are about, this is the Institute of Health metrics. I wanted to put this up there for those of you who have watched me each week talk about this. The projection of deaths by April 1st is significantly less than the projection had been a number of weeks ago when I presented this. And it reflects the data that they're given, of course, which is the number of tests that are positive and the number of deaths that are recorded. So this may be just a simple reflection of the data in Armenia. Again, it has some issues, the data in Armenia, not because it's not transparent, but because I think it's largely underreported, not the deaths, but the total number of cases. This, however, I think is really the take-home message here, that this is the total number of ICU beds available in Armenia in general. They did increase capacity for ICU beds during their first surge, but look at the number of ICU beds actually needed, in post-war, including, this includes, probably, actually, no, this is just COVID use for ICU beds. And so really it won't be until after the end of the month that we'll get sort of, or in February, really, we'll get sort of back down to what is considered normal capacity for Armenia. So it's still a really, really significant problem in Armenia.
It really is a great pleasure to introduce our next speaker, Sarah Golian. I first met her I guess about a year and a half ago, and she's very down to earth. She grew up in Los Angeles, where she practiced as an attorney before repatriating to Armenia. She is now doing a terrific job as Chief of Staff for the High Commission of Diaspora Affairs. She's the co-founder and chief executive of Impact Hub. She's going to be talking today about creating investment and philanthropic projects in Artsakh, with the hope of creating job opportunities. Thank you so much, Sarah.
Thanks for the opportunity. It indeed was only almost just a year ago that we were together in person in New Jersey. And we had a really wonderful exchange, and who knew that a year later we would be here and discussing the global pandemic and the post-war situation in Armenia. For whoever I haven't met, I moved to Armenia 9 years ago. And when I practiced law for about 6 years in the United States, and then I moved to Armenia and started Impact Hub. I'm no longer actually the chief executive of Impact Hub because I needed to resign that in order to join the government. I joined the government about a year and a half ago, post Velvet Revolution. So the priorities we had set out for ourselves when we when the Office of the High Commissioner for Diaspora Affairs was created, it was created in a sense to be the office that would manage Armenian diaspora relations after the Ministry of Diaspora was closed. And the 5 goals we put forward when we started were basically, I think, first and foremost, inviting and creating pathways for diaspora Armenians to be involved in building institutions in Armenia. And that was something that we saw a lack of previously, lack of avenues for diaspora Armenians to be involved in not only creating institutions generally, but specifically within the Armenian government. So that was one of the goals we set forth for ourselves. The other one is repatriation and integration. There was and continues to be too many hurdles for people who are seeking to repatriate to live in the country and integrate into Armenian society. So the very important goal was also to identify what those roadblocks are, seek to try in some sense to be able to overcome those roadblocks, and then also create an ease of integration for people wanting to repatriate and live in Armenia. The third goal was to be problem solvers, mostly because and this was really focused on philanthropy and investment. Over and over again, we were hearing all kinds of stories and examples of diaspora Armenians who were seeking to invest in the country or seeking to do philanthropic projects in the country, constantly dealing with problems. And so we sought to create a mechanism where we were going to be the problem solvers for our diaspora Armenian compatriots. Fourth was bridge building. And of course, a lot of our bridge building programs, unfortunately, had to be put on the shelf because most of it had to do with flying around the globe, meeting with diaspora communities, as well as having a very large Armenian diaspora conference that we were meant to host last September. Obviously, that was canceled. And we also have a number of youth programs that we inherited from the Ministry of Diaspora that were actually good ideas, and we kept those. So whatever we inherited from the Ministry of Diaspora, which we believed had a positive outcome, we actually kept. We didn't do away with, everything from the previous administration. So these were the goals. Now, in terms of the roadblocks, I thought maybe it'd be interesting for you to hear 1 year later what we've learned related to each of these areas. And I think the one that I am most, interested in talking about is the invitation of diaspora into building institutions in Armenia. So the two ways that we plan to do that was our IGORTS program. So IGORTS is a fellowship program that was created by our office. And basically what it does is it invites diaspora Armenian professionals to do a fellowship for 1 year post-grad. So it would be, you would have to have either a master's or a PhD or a law degree post-grad, and you would serve in Armenia's state institutions for 1 year. So when we announced this program, initially I thought it would be a good idea to just pilot it with 20 people, because who knew how that was going to work, to have people from all over the diaspora working inside of the government. It had never really been done before on an institutional level. And so I suggested that we do 20 people. The Prime Minister loved the idea so much that he upped it to 100 people and gave us the budget and the backing for it, which was great, that we had such a strong support. But it was definitely much more difficult to roll out something with 100 people than 20. Long story short, we ended up getting 50. So now we have actually 46 and a few more coming. 46 diaspora Armenians working in 17 state institutions, everything from the Ministry of Health to the Ministry of Education, emergency services to Ministry of Social Welfare. And so it's a grand experiment. And we found two major problems with this. One is that on the government side, the state institution side is not necessarily as prepared or has necessarily the mindset or the way of working in order to be able to get the most out of these diaspora professionals. So oftentimes our diaspora professionals are, for lack of a better word, hitting their head against the wall, trying to get things done, trying to break through roadblocks, break through institutional barriers, things that they're trying to constantly put aside, and having a very difficult time. So that part of it has been difficult for them as well as for us. And the other part is on the diaspora professional side is the understanding that this is a marathon and that they're likely not going to change as much as they'd like to change in those institutions or shift, et cetera, within the 1 year that they're going to be there, and trying to manage that frustration among the people who have moved to the country and are now working inside of these state institutions. So that's what we've learned in this 1 year. Yet we're going to continue it, and we're going to do a new iteration of it this year, and we're going to be announcing it and bringing again hopefully a new class of fellows into the government. And you know what it is? It's very interesting. Those ministries, for example, the Ministry of Health is a really good example. Those ministries who with open arms have welcomed these diaspora professionals and have invited them to have a seat at the table in high-level meetings are the ones who have gotten the most out of these diaspora fellows. The ones who have kind of said, okay, well, this is a program, we got to figure out where to put these people. They didn't know where to put them in terms of their desk. They didn't have a computer. I mean, these kinds of disorganized things were the ones who obviously got the least out, are getting the least out of those professionals. So that's what we learned with that program. Another thing that pains me is that when I started this job, I was always, saying that we are going to get away from diaspora Armenia humanitarian assistance. We're not going to do humanitarian. We're not going to do money. We're going to do building institutions together. And turns out that COVID, Lebanon, and the war brought us right back to Armenian diaspora relations that are based on humanitarian assistance and supplies being sent to Armenia. But it is what it is. It's what needed to be done, and we did it, and we continue to do it. In terms of the war, our office was responsible for 3 areas. So when the war started, every office in the government had a directive on what they were responsible for. Ours was to coordinate the humanitarian assistance, the flights coming in, the logistics, where flights were going to come from, what planes we were going to send to diaspora communities, what was needed, etc. And we were responsible for not receiving, but coordinating until Armenia. And then once it was in Armenia, all of those supplies, it went to the various ministries. So health stuff went to health, and defense stuff went to defense, and emergency services dealt with all of the mixed stuff. That was our responsibility. The other one was to organize, not directly, but indirectly, a lot of the protests that were happening around the world in terms of messaging, in terms of informational campaigns, to try as much as we could to get our diaspora compatriots to be speaking, with one voice, or at least to be hitting certain points in the various protests that were happening around the world. And then volunteers. We coordinated 2 groups of volunteers. One were physicians and healthcare professionals from diaspora that were coming and were serving in the various hospitals. Many of them were in the Goris hospital. Some went to Stepanakert and were treating our wounded soldiers during the war. And the other, which I can now say, since we're not in the war anymore, is we had people who came to fight. We had groups of diaspora Armenians who came with their jokat, I don't know the English word, with their group, who they already had, had training, they had the expertise, and they came and were deployed to Karabakh. So we were also involved in that, although at the time wasn't something we were talking about, because there was a concern that we would also be accused of bringing in mercenaries, quote unquote, even though they were diaspora Armenians, all of these people who came in. Post-war, now in this post-war era, we are working with the ministry, our new Minister of Social Welfare, Mesrop Arakelian, who is, we've just met him. He seems to be a very practical, good guy, as well as obviously our Minister of Health, who we have always had a great working relationship with, Arsen Torosyan. He's really one of our closest colleagues in the government. And we are going to be working in 3-4 areas, really. The rebuilding of Artsakh. So just in terms of the numbers, we had approximately 90,000 displaced people. 90,000 people left Artsakh during the war. Approximately 50,000 have gone back. And so we have another 40,000 or so who we're trying to, not we, our office, but in general, the government is trying to figure out who's going to go back, who's not going to go back, who has something to go back to. Those people can be rehomed in the land that we still have, under the land that's still Armenian. But of course, we're going to need to be building housing. So one of the areas where we're going to need to engage our diaspora organizations and individuals on is the housing situation in Karabakh, in Artsakh. Obviously, it's going to be a more denser living, but according to our Minister of Social Welfare, it's very much doable, and there's plenty of space if we're able to build housing. The second one, equally important, is employment. Now in this post-war era, what does employment look like in Artsakh? It's unclear to me at this point how many of the various economic opportunities that were there pre-war are still there. One example would be the wine industry. We have a very robust wine industry both in Armenia and in Artsakh. But for example, the Gataro winery is no longer ours. It's not in Armenian land anymore, and so that the head of that winery is deciding. He's going to decide if he will come back to Artsakh and replant in another place, or he's going to move to Armenia. So these are the things that we need to think about. And obviously, there may not be an appetite for building of new capital expenditure projects, building of new buildings and things like that. And so perhaps the way to create job opportunities in Artsakh right now is more sort of on the soft skill side. Maybe it's the tech side. I don't know. We have to kind of sort that out. We have to sort out what employment now looks like in Artsakh in this post-war situation. The other area we've been asked to work on are to tap into diaspora professionals who are experts in prosthesis. And this is another area that I'm looking to work with you guys on, and to try to understand who it is. What the Minister of Social Welfare wants is for professionals to physically come out to Armenia, to watch how we're doing things there, and to give us advice. So that's the ask. We put together a list of about 30 professionals in the diaspora who seem to have the expertise and knowledge in this area. And I was just about to start emailing people and see who can work with us on this. The other area is rehab, physical and mental rehabilitation. We've been working with already some very, very active groups, many of people on rehab specialists coming out to Armenia to work with our wounded soldiers. And then obviously, we would like to also do some work on mental health. I have people who've also emailed me saying that they'd like to come out and maybe lead some support groups. So this type of work is also being managed at the moment by our office.
We are also very honored to have another gentleman with us who's very involved in Armenia in helping bring business opportunities to Armenia and hopefully help fulfill some of the items that Sarah was talking about, creating jobs for the refugees and for the people in Artsakh and Armenia. Oscar Tatosyan is the honorary consul to the Republic of Armenia. He's responsible for promoting trade, commerce, and civic activities for Armenia and Artsakh. Like so many of us, he's involved in a lot of different Armenian organizations. He's a board member of the Armenian Assembly and a member on the board of Fund for Armenian Relief. Oscar, thank you so much for joining us this evening.
I just wanted to share some of my thoughts as a volunteer, as a businessman, as an entrepreneur, but also as a appointed representative of Republic of Armenia, sitting in Chicago. I'm speaking to you from Chicago in our offices. And from Chicago, we're responsible for Illinois, Wisconsin, Minnesota, Missouri, and Iowa, those states. And I believe my colleague, Mr. Badr Sarkisyan's on the call also. He's originally from Hayastan. He works with me here in the office. Before I get in, just a few points I wanted to make on how we can make a difference for Armenia. Obviously, there's some immediate needs with the refugee situation. You're all aware of the COVID situation and the cold winter coming up, and many organizations are doing their work, too numerous to name, whether it's HMADZ is doing a lot, AGBU, ARS, and I know we are encouraging everyone to support those good causes. But at a macro level, long-term level, it's going to require, I believe, a different type of thinking, a different conversation to take Armenia, to rebuild it for the future, it's going to take different conversations, different actions. And it's going to require our people to get together, our institutions, as Sarah mentioned, and our leaders. But I'm optimistic for the future. So in no particular order, again, the number 5, Sarah, you had 5, I had 5 also, 5 different areas to look at. And I believe if we strengthen the economy of Armenia between trade and commerce, whether it's investment funds, markets, that would be essential to make a difference for Armenia. These 5 points are going to make a difference. When I was appointed to this position by Ambassador Grigor Hovhannisyan, he said, I want you to focus on trade in 3 particular areas. And he was wise. The areas are technology, agriculture, and tourism. And we know that tourism had grown 14%. The economy had grown 7% before all this catastrophe came upon us. So if there's one outcome from this call, if there's one thing I would like you to remember, write down, we should take the Armenian relationship from aid to trade. From aid to trade. So that's where the diaspora can make a big difference. Another area, and again, Sarah, your Office of High Commissioner has already started on it, is come up with a strategy and a plan to engage the youth. I don't know if it's 25 to 35 approximately, but if we come up with a plan, a strategy, an investment to nurture the youth, educate the youth, and connect them to the Republic of Armenia. It's been 30 years of independence. So their experience, they have a good foundation to look at. That Igor's program sounds like an excellent program. If we don't invest in them, if we don't appeal to them, we will lose them. They will go elsewhere. If we don't nurture our youth, we will lose them. So that's the second area. Another area I'd like to have us look at would a larger voice, a larger role for the diaspora in Armenia. And it's refreshing to have the High Commissioner and Sarah, both of you from the Spurk, from the diaspora working there. And this is not unique. For instance, the Lithuanian parliament has diaspora members. Question, should there be some seats in the parliament for diaspora Armenians? There was an article last week in the Mirror Spectator on that. And I think there's some wisdom to it. And our voice should include some increased accountability and transparency. Transparency and accountability. That is going to be essential going forward. So that's the voice we need in the institutions. What would be the situation in Armenia now? Maybe if we had spoken up more in the future. I'm sorry, if we'd spoken up more in the past, what would be the situation now? Therefore, I think that's an area that requires a shift. The fourth area, here in the diaspora, increased civic and political activism. I think we all became a bit complacent after 20 years of activism. So we need to reactivate our lobby in Washington and in the states, whether it's ANC, Assembly, Legate, or in our state houses. A renewed energy towards having influence and looking for support, and not just genocide, more than just genocide recognition, and also a strategy to work with the media. I think we were inadequate with our media relations. The fifth area, as a member of the diaspora, American Armenian growing up, I'd like to see us support the Armenian church more so, the Armenian church and its historic role. History has taught us that our survival has been intertwined with our church and our faith. I'm not a historian, but I think you can make a case for those nations who lost their faith didn't value and nurture their faith would cease to exist. So there's a role for the church, important role that we should take seriously. I remember when Armenia was first established and they came to New York for the United Nations, there was no office space. They came to the diocese and the first offices were there. So the church state working together is very important for Armenia. The church's doors are open to everyone. We need to strengthen it. So those were the 5 basic points that I think we have to, I would suggest we keep in mind, again, in no particular order. The first one, strengthen the economy. Number 2, engage and encourage the youth. Number 3, a larger voice and role for the diaspora. The 4th, to increase our political activism and engagement. And 5th, support for the institution of the Armenian Church and maintain our faith. I think with those focus areas, just a few, we can make a difference in Armenia.
It sounds like your office will be communicating closely with the Ministry of the Diaspora to facilitate this transformation. Sarah, what do you feel your role is in working with people like Oscar to help realize the goal?
I wanted to actually, Larry, comment on one of the things Oscar said related to having diaspora Armenians in parliament, and not just parliament. So one of the narratives, if you will, in general now, is that there wasn't enough professional competencies in the government. And the more hardcore criticism is that the whole government is incompetent. So one topic that the High Commissioner and I keep talking about is how are we going to engage, how are we going to convince diaspora Armenians to come and take positions inside of the government as deputy ministers and ministers? And how are we going to change the laws on the books to allow for it? So for example, you can be a deputy minister and be a dual citizen. So I'm a dual citizen. I'm a citizen of the United States and a citizen of Armenia. Therefore, I can never be a minister because I'm a dual citizen. The Constitution doesn't allow for me or anybody on this call who may have both a citizenship of Armenia and a citizenship of another country to be a minister. The highest level we diaspora Armenians could ever be would be, for example, a deputy minister. It's the same with parliament. As far as I understand, we can't have dual citizens in our parliament. So we need to change our laws, actually. And in fact, it's interesting that Oscar mentioned that, because it's something that I've been kind of noodling on, and even called our vice president of our parliament, Lena Nazarian, and said, we have to have a discussion about this in parliament. I know we're the executive and you're the legislative, but is anybody thinking about changing some of the laws on the books so that even dual citizens could be in these positions? Anyway, I keep kind of thinking about this. And now let's say we were able to change the laws. Well, then how are we going to attract diaspora Armenians who have comfortable lives, high salaries, in other places to come and take these positions? Well, that's the second, sort of hurdle we have. So anyway, these were just some of my thoughts as I was listening.
This was really wonderful. It was a great conversation. We had some amazing people with us this evening, Oscar and Sarah and Solene and Kim and everybody that participated and asked questions. So thank you so very much in helping advance our thinking, which will help in our planning of what lies ahead.
Thank you.